My name is Basel Edris. I'm a clinical cardiac electrophysiologist at King's Daughters Medical Center. I was born in Damascus, Syria, where I graduated from medical school. And then I went to University of Miami, JFK Medical Center, where I finished my internal medicine residency. After that, I was an assistant professor of internal medicine at University of Kentucky in Lexington for a few years. I always knew I wanted to do cardiology, so I decided to go back and finish my general cardiology training at Marshall University in Huntington, West Virginia. Then I spent extra 2 years in Worcester, Massachusetts, where I finished my electrophysiology training. I graduated from University of Massachusetts, and me and the family decided to come back to Ashland. As a cardiac electrophysiologist, we deal with abnormal heart rhythms. There are two kinds of abnormal heart rhythms. It could be fast and could be slow. And for the slow abnormal heart rhythms, that's when we come in and do pacemaker implant. And also for the fast heart rhythms, we deal with different kind of arrhythmias like SVTs, atrial fibrillation, atrial flutter. We also deal with ventricular tachycardia. That specific rhythm has risk factor for sudden cardiac death, and we implant defibrillators. Atrial fibrillation is one of the most common abnormal rhythms in the United States. There's no specific symptom for atrial fibrillation, but it's more like different things that can tell you or lead you that you may have atrial fibrillation. It could be palpitations or heart racing, shortness of breath, fatigue, and dizziness. Atrial fibrillation is more like a chronic problem, and it comes with some consequences. If you have certain factors and have atrial fibrillation, that puts you at risk of having stroke. We treat atrial fibrillation with different ways. It can start from medications, and it can end up with an ablation. In our heart, we have two top chambers, that's called the atria, and two lower chambers, what's called the ventricle. And the top chamber and lower chamber usually beat in synchrony with each other. And what happens in atrial fibrillation, they go out of synchrony. And usually we found specific spots that trigger the atrial fibrillation, most commonly those what we call pulmonary veins. There are 4 veins attached to the back of the left atrium. And most commonly, that's where the atrial fibrillation comes from. So what we do with the ablation, we try to electrically isolate those veins from the rest of the heart so it won't cause further episodes of atrial fibrillation. And there are 2 types of ablation. There's a freezing, what's called the cryoablation, and there is the more like what we call burning or radiofrequency ablation. We offer both treatments or procedures at King's Daughters. I come from family that has a lot of doctors, so I always looked up to these family members, and I always wanted to be in medicine. I didn't know what it was, the specialty, but I always wanted to be a medical doctor. My goal was to get the best education, best training, and start helping people.